Thank you, Sonia. Our next presenter is Dr. Aurora Jackson from UCLA Luskin School of Public Affairs. Her work focuses on single mother welfare recipients, so it's a good follow-up to the previous presentation. Thank you.
Well, I said to Catherine Eden that I was very happy that she didn't have a PowerPoint, because I don't either. And there are two things. I want you to look at me, not at the screen. The other is that there's something to be said for going last, or close to last, because much of what I was going to say has been said in one way or another. So I'm hoping that I will say it in a way that you might find interesting. My presentation today is guided by the following questions. What are the primary barriers to engaging parents of young children living in poverty? What approaches have been tested with respect to supporting parents of young children in the welfare system? What do we know about parenting needs of low-income fathers versus mothers? Now, these are not easy questions to answer, but I'm going to try to some extent to do this because there's not a lot of information on these questions in terms of testing that has been done. So, but first, it's important for you to know that the focus of my research has been on maternal psychological well-being, parenting in the home environment, and child developmental outcomes among families headed by single black mothers, current and former welfare recipients with young children. So I am primarily really interested in poor black families. I think we know too little about individual differences in these families because most of the research compares them with white families. When white families are studied, they are compared with each other. When black families are studied, they are usually compared with white families. And we know little about individual differences in that population, and there are some who function quite well. And we need to understand, in order to help those who function less well, we need to understand how those who are functioning well, how they're doing it. And I also look at risk and resilience as well. Now, for black children, more than half are being raised in a family headed by a single parent mother. These families, as you probably already know, are disproportionately poor, and studies have shown that poverty and economic hardship have consistently negative effects on children's socio-emotional, neurobiological, and cognitive functioning. Correspondingly, studies have found that parents' economic stress and hardship are environmental factors that are associated with increased depressive symptoms, less efficacious parenting, and thereby less optimal child outcomes. Now, given these conditions and circumstances, recent research has raised issues about the role, as we've already said, of non-resident fathers in outcomes for poor and near poor black children. Indeed, there is evidence that the extent of fathers' contact with their children and the children's mothers is associated with beneficial developmental outcomes for preschool children, and that such contacts may be beneficial for children, not necessarily due to the father's greater involvement in child rearing, but in the greater emotional support father-child contacts provide to mothers. There also is evidence that non-resident fathers' involvement with their children is determined by their relationship with the child's mother. We have already learned about these serial fathers and serial whatever. To date, however, intervention approaches that focus on honing relationship and co-parenting skills between non-resident biological black fathers and the mothers of their children have yet to be developed. Although relationship skills education programs in middle-class, married, mostly white couples have existed for several decades. Until recently, little rigorous research existed on the effectiveness of similar programs for low-income couples or unmarried parents. I know of no such studies that have focused on individual differences in black single mother families. Recently, my colleagues and I carried out a small feasibility pilot study to gather preliminary data for a next stage grant that will address an important gap in currently available intervention options for a population that remains at high risk for poor parental psychological well-being, parenting adequacy, and child developmental outcomes. We recruited 30 low-income single Black mothers with a 3 or 4-year-old child through the Los Angeles County Department of Public Social Services. I did not know that that is the best functioning welfare department in the country, so thank you for letting me know that, because I work very closely with them, because that is the welfare department. We randomly assigned half of the mothers and the non-resident biological fathers of the focal children to a 3-month psychoeducation group intervention that met weekly to facilitate more emotionally supportive and cognitively stimulating parenting. The way we got the fathers was the sample really consisted of the mothers, and we asked them to involve the non-resident biological father of their 3 or 4-year-old child. And some of the mothers actually who wanted to be a part of the study could not be a part of the study because they did not know where the father was. He was not available to them, so he was not one of those who was trying to do the right thing. The intervention focused on, as I said, the co-parenting relationship. We wanted to determine if we could engage a sample, because these samples are hard to engage. And I have to tell you, much of the research that I have done has been collecting my own data because I'm interested in single Black mothers, and for some reason, this population of people like me. Now, why? I have no idea. But one reason may be that I will do anything that does not involve sex to get the sample. And they know that, because I go after them big time. Now, the other half of the sample, the control group, was called monthly to inquire about how the mothers and fathers were getting along. So half of the sample, we wanted them to attend psychoeducation group meetings over a 3-month period weekly. The other half, we called them on a monthly basis to kind of stay in touch with them. And all of the parents met for an initial session in which we gave out information about the importance of non-resident biological fathers staying involved with their children. We were not interested in social fathers. We were interested in really supporting biological fathers, because many of these mothers had other relationships as well. And many of the biological fathers don't recognize and realize how important they are, really, to their children. So they go on to the next mother and her children and make a baby with that mother, and so they may be involved with these babies for a short period of time. But we're interested in trying to get them to stay involved with their children over the life course of the children, regardless of the relationship with the mother. All of the parents met, as I said, for an initial session. The experimental, it was difficult to get couples in the experimental group, as you might imagine, to attend weekly psychoeducation group meetings. Although we did retain the entire sample over the course of the intervention. Now, we haven't analyzed those data yet, and we did find some positive results of the intervention. And I need to tell you, in terms of those group meetings, to our surprise, the men who came were more talkative and more verbal than the women. These meetings were very important to them. They said people don't often give them a chance to get the kind of help that people offer to the mothers of their children. And of course, if they came to our group meetings, they wanted to be fathers to their children. The data, as I said, have not been completely analyzed yet. However, some barriers to attendance for group meetings were, since I'm supposed to look at barriers, were the lack of trust regarding sharing personal information, as you might imagine. Transportation difficulties in Los Angeles, you need a car. And many of them didn't have a car, and for some of those who had cars, they didn't have gas money. So that was difficult for them. and no money for car fare, depressed affect. Many of these men and the women had depressive symptomatology because of circumstances in the larger environment. And the men talked a lot about that. There's been a lot in the news about this in terms of black males lately. Well, the men in this group talked about how police stopped them for no good reason, how even if they got a job that was far away, they couldn't get to the job and that was very depressing for many of them. I have only 10 more minutes left. Is that what you're saying? Okay, daily hassles. In terms of violence in the community, several people witnessed people having been shot, killed, paralyzed during the course of a 12-week period. And poor job prospects, as well as feelings of failure and guilt. Now, what do these circumstances have to do with child development in the present context? A recent book by Robert Putnam entitled Our Kids, the American Dream in Crisis so eloquently points out young children's early experience and socioeconomic environment influence their neurobiological, cognitive, and socio-emotional development, and that these effects are powerful and long-lasting, but are not necessarily irreversible, and they are consistent with attachment theory, which indicates that if we can change the environments of families, then we can change the circumstances of children. Okay, now the most fundamental feature of these experiences is interaction with a responsible adult, as everybody has said, and that's typically parents. Neglect and stress, especially between the ages of 3 and 5, including when the child, what we now call toxic stress, can impede successful development. Indeed, chronic neglect is often associated with a wider range of developmental consequences than overt physical abuse. In short, beating kids, as we all know, is bad, but ignoring them is even worse. Children at any socioeconomic level can encounter adverse experiences that have negative consequences, but those who grow up in low-income, less educated, single-parent families are at considerably greater risk of experiencing such traumas as parental death or imprisonment, physical abuse, neighborhood violence, drugs or alcohol in the family. The toxic stress that can determine child developmental outcomes is typically a reflection of considerable stress in the lives of parents. Some severe, such as depression, some in terms of the pile of hassles. In fact, maternal stress during the child's first year can be quite disruptive. Now, I was going to go through all of this about studies that have been done on animals, and those that were licked by their mothers were better off over the life course of these rats than those who were not. And since I was asked also to speak about foster children and the foster care system, which is not really a scholarly focus for me, research with animals has shown that young rat pups who have non-licking mothers, if they're placed with mothers who lick them greatly, that they grow up also more like children, biological children. So it's not a biological thing necessarily in terms of what children need and what they can get in the environment. So providing physical and emotional security and contact, hugging, for example, is the human equivalent of a mother rat's licking and grooming behavior. Parents who have a warm, nurturing relationship with their children can help them to build resilience and buffer stresses that might otherwise be damaging. Now, interventions, there have been a few interventions, and I was asked to speak about interventions that have been tested. There are not very many. There are not very many of them. The disruption of, and as Catherine Eaton pointed out, and as the Fragile Families data points out, that oftentimes these couples feel very hopeful about themselves and their relationship when the baby is born, but these relationships last. By the age of 5, these relationships are no longer, these couples are no longer together. Now, so the disruption of single parents' relationships is significant because children growing up in a household, in households that do not include both their biological parents are at greater risk of poor outcomes. Although although most of this evidence is based on white samples, there is considerable interest among policymakers in supporting unmarried parents' efforts to maintain their relationships. An explicit policy objective of the 1996 Personal Responsibility and Work Opportunity Reconciliation Act was increasing the number of children raised in two-parent families. In 2001, the Administration for Children and Families launched the Healthy Marriage Initiative. In 2005, Congress approved $100 million in annual funding, and in 2010, $75 million was added to this. Now, a project that was carried out by Mathematica Policy Research Corporation tested voluntary programs designed to help unmarried, economically disadvantaged parents who were expecting or who had a baby strengthen their couple relationship. And they did the same thing that I did in the study, in the pilot study that I was doing. They assigned some to get a very intense program that required them to come for weekly sessions about parenting and relationships and all of this. And what they found was that 45% of those people who were to get the program did not come. And their outcomes were not very good. The model was implemented in 8 states and tested using a random assignment research design involving over 5,000 couples who were Black, Hispanic, white, and other. So they again were testing, were comparing races of people. And the results, based on a 3-year follow-up survey, indicated that the program did not succeed in the central objective of improving the couple relationship, increasing the quality of co-parenting, or enhancing father involvement. The impact on the children's socio-emotional development, however, was positive but very modest. Indeed, getting couples to attend sessions proved challenging, and 45% of couples who were offered program services never attended the sessions. Now, they kind of, they decided that a lot of this had to do with the fact that they weren't married. These programs have worked with married couple families and with middle-class families, but a lot of they thought that a lot of the lack of success of this program had to do with the fact that these people weren't married, that there was multiple partner fertility, that there was a lack of trust of those people delivering the service. And so unmarried parents face distinct relationship challenges that could influence the efficacy of such programs. My belief is that rather than trying to, I agree, and I believe that co-parenting is very important for these couples, but rather than focusing on their romantic relationship, I think we should really focus on the co-parenting relationship and also give information to them about the importance, really, of fathers staying involved with their children. And mothers are very central in that process. We need to help mothers to help fathers, these poor Black fathers, to stay involved with their children, because oftentimes the mothers, when they move on from the relationship, because this man can't give them the kind of material support that they need, they move on from this man and he moves on to another relationship. And I think that policy should, or that programs, because it's not a policy thing, it's a program thing. Programs should encourage these men to stay involved with their children. The other thing is, in terms of the study that I tried to carry out and tried to see if we could engage these men, I would call these men on the phone to encourage them to come to our meetings. And one man said to me, you got any money? And I said, no. He said, because I'm working on money right now and I don't have time to do that. I've been thinking about this and I don't know how to do it, but I'd like to try it. I would like to do some experimental research with the Department of Welfare in Los Angeles, gathering a sample again, but also, and getting the mothers and the fathers, But if I could also connect it with a business of some kind or another, who would also have services for these men in terms of if they could get some training that they liked or whatever, and if they participated in the program, they would get training, and then there would be a job at the end of this for them because they want to have something. The other thing I want to say is extending to making education up to 2 years of college free is a very good policy for this population, because education is very much associated really with positive outcomes for children. Parents with more education are better parents to their children. They spend more time with their children. They know how to solve problems with their children. And so that's pretty much, am I over now? Okay. Oh, I did want to say one more thing in terms of what other kinds of programs work. Because in terms of taking programs into the school system and teaching young boys how to, the evidence seems to show that information giving doesn't work. Programs that have to do with approaches that involve homework, modeling, and practicing work better than simply giving out information. So this means that we need programs that actually engage these parents and work with them towards ways to better parent their children and to solve the problems that they have in terms of stresses. Okay.